Welcome back to the Healthy Chicago podcast, where local health professionals and their guests discuss the latest public health issues affecting Chicagoans.
All right, we're back with another episode of the Healthy Chicago podcast. I'm your guest host today, Dr. Alex Sloboda. I'm the medical director of Immunizations and Emergency Preparedness here at the Chicago Department of Public Health. And today we're talking about emergency planning and how Chicagoans can best prepare themselves for future emergency situations. We do a lot of public health emergency preparedness work here at CDPH. So I'm excited to speak with us about emergency preparedness and some community initiatives we have going on at CDPH for Chicago regarding this topic. We have a wonderful guest who also works at CDPH with us today, Joe Amaro, and I'll let him further introduce himself.
Absolutely. Thank you very much. Thank you for the opportunity.
Yeah.
My name is Joe Amaro. I am a Senior Emergency Management Coordinator with the Department of Public Health. I will admit I'm a little new to the agency. I've been here for about 6 months now.
Okay.
But prior to joining the agency, I've been working for other public health departments in the collar counties in the region, doing a very similar type of work.
Okay. Awesome. And can you tell me a bit more about your role, your role now with CDPH, and kind of just a general overview of the type of work the emergency preparedness team does at CDPH to keep Chicagoans prepared, healthy, safe?
Yeah, absolutely. So the emergency preparedness program is really responsible for participating in all of the departmental activities that revolve around emergency management. And they kind of, the way they frame that is there's really 5 phases of emergency management, all the way from prevention, preparedness, mitigation, response, and recovery. But really that's just a fancy way of saying, we're thinking about these things before they happen, while they happen, and then during the recovery process after they happen. Being public health emergency focused, we're really focused on activities that impact the public's health at large. So that can be a suite of emergencies, with common things. Now, unfortunately, infectious diseases are becoming a little more commonplace, it seems. Of course, everybody's familiar with COVID-19 and maybe measles outbreaks that have happened. But there's all sorts of emergencies that can take place that can really impact the public's health. Thinking about maybe flooding events or extreme weather, right? You have the opportunity for maybe different infectious diseases to come out. You have people who maybe have mold in their basements as a result of flooding. Even wildfires, although we don't necessarily have those here. There have been times in the past where even in Canada there's been wildfires, and certainly it affects respiratory health down in the U.S. as well. So there's definitely a variety of emergencies that our program focuses on. But certainly the IN is really worrying about the public health impacts of those different emergencies.
Yeah, no, that was a great overview. And yeah, obviously we're all familiar with the big COVID-19 pandemic, and we all survived, or many of us worked hard to get the city of Chicago through that. But yeah, there's been other disease outbreaks. You talked about measles. There's other potential ones in the future that we're trying to prevent any way we can, and prepare the city as well. And you also kind of talked on a lot of the environmental things. Climate change is having a big impact on this country and many communities, and there's different forms that can impact us, whether it's more precipitation and raining and flooding, or these wildfires that are happening. And even if it's far off, a lot of that, when you have a big fire and the smoke can travel a long ways. I remember a couple summers ago we had those Canadian wildfires, and it really impacted the air quality for a good week or more in Chicago. So a lot of things that we're always thinking about and trying to prevent, prepare for, and then respond to if we have to. So
absolutely. And I think you mentioned, there's it might not just be local things. You mentioned, like you said, the Canadian wildfires, but I know, even after other examples, the Haiti earthquake that happened, Hurricane Maria, even the current asylum seekers mission, anytime you have, events in this global world where you see, large shifts in population and people moving from one place to another for their own safety, you're putting people in a place that they're not familiar with. They're not familiar with the hazards there. If you came from, if you were brought here after the Haiti earthquakes and it's the middle of winter time, now all of a sudden, because you don't have a coat or a jacket that you brought with you, that becomes a public health, that's a threat to the public's health at a very basic level. I think so. I agree. I think the global nature of emergencies really has an impact for emergency preparedness.
Yeah, no, I think the global aspect is really important because, anything in public health anywhere else in the world can impact us here in Chicago. Like we just, there was, this past year, there was a Marburg virus outbreak, which is a really dangerous virus similar to the Ebola virus that occurred in Rwanda. And a bunch of international organizations, the WHO, the government of Rwanda and their healthcare system did an amazing job responding to it. But obviously, people travel all around the world every single day, and so we also had to make sure that people traveling back to the United States were safe and healthy, and those coming through the O'Hare Airport and things like that. So yeah, we definitely live in a global, interconnected world, and we gotta make sure we are helping each other out and keeping people safe. So
absolutely.
All right. But yeah, let's talk a little bit about what's going on here in Chicago in our communities. Can you tell me about some of the community initiatives CDPH is engaging with to better prepare Chicagoans for various public health emergencies?
Absolutely, absolutely. So really as of late, and I say as of late, but it's been going on for a couple of years now, but there's been a big emphasis on, preparing together and what it means to be prepared as an individual, what it means to be maybe prepared as a family or as a community. And so recently, our program and others at the Department of Public Health and across the city have been working on developing kind of emergency preparedness kits, putting together items in, a single bag that are reflective of a variety of supplies that you might need during an emergency. And so understanding that maybe not everybody has the resources to maybe buy those things outright or even the knowledge to, okay, what should I put in an emergency preparedness kit? So the city's been working on an initiative to kind of order a couple thousand of these kits actually.
Great.
And fill them with critical supplies. And we've started working with various community-based organizations, different faith-based organizations, to provide education on what is an emergency kit, why it's important to have one of those kits ready, as well as actually giving away kits to those different groups that they can share with their constituents, that they can put into the community to make sure that people are being prepared. So I think that's been some wonderful work that's been going on, and will actually continue to go on as we move through the 2025 year.
Yeah, no, that's great. Yeah, it's always, I think, kind of what about what we're going to talk about today is like these, like the actual, like the resources, the kits, the tangible things you can use in these situations, as well as the planning. So, and we kind of talked about the different layers, like obviously what resources do you need in an emergency as an individual, and what's your plan, but also whether it's your family unit or your friends or those that are in your living situation, and then also those that are like in your community as well. So there's also multiple layers to preparing for emergencies, and really if you're developing a kit, like where is it at, what's in it, what do I need in it. There's some things that are generally should be in a kit, and there's some things based on like your health history or your individual situation to put in it, and kind of making those plans as well. So I'm excited to kind of get into it a bit more. You kind of talked about the different organizations CDPH is partnering with, whether it's community-based or faith-based organizations. Can you tell me more about kind of how that came about, and why those are kind of a focus of particularly around like the emergency planning training effort?
Absolutely, yeah. So I think, and I hate to keep talking about COVID, but it really, was incredibly impactful, and it was a time where I think emergency management and public health really learned a lot as a profession. And I think, like you're talking, the importance of engaging with different community-based organizations. I think COVID exemplified that. Maybe the people that were most impacted by it were people who maybe had less access to critical resources. So I guess what I'm trying to say is nothing is experienced in isolation, right? Maybe the same people who had limited access to healthcare were also the same people who struggle to find daycare, or maybe struggle to access a quality food resources. And so I think by engaging with different community-based organizations, you're linking together those critical services. You know, if you're handing out these emergency kits, for example, at a food pantry or a daycare, right, you're able to work with maybe the groups in the city who are at the highest risk, who have the highest level of need. So I think that's the importance of being in the community and working at what they call that hyper-local level. So that way you're really getting to the people with the most need, you know, at the best time possible with the resources that are needed. As far as faith-based organizations specifically, you know, I think there's been a number of instances where you see the capabilities that those groups have, you know, whether they're small, you know, congregations at the community level or whether they're massive national organizations. I think, again, I know it was a long time ago, but looking back in, I think, 2005 hurricanes, Katrina and Rita, you know, I think you saw how those different community and faith-based organizations were positioned to respond much more quickly because they're the ones, you know, at the community level experiencing those hard outcomes. But those are also organizations that do provide services regularly. You know, they might perform, you know, food distribution, sheltering operations. They're able to quickly access a large group of volunteers. You know, they're able to nimbly access funds and maybe spend those funds, whereas cities, states, or even the federal government, right, there's a lot more levers that have to move to be able to unleash some of those resources. So I think being able to partner with those groups at the ground level is incredibly important to be able to act quickly and to act with the local community's best interests in mind.
Yeah. No, and I think there's an important point as well, is that a lot of people think when there's like a big emergency or a natural disaster, it's like a equal leveler, like everybody's equally impacted by an emergency situation, but really it exacerbates like disparities and inequities that are already existing and makes them worse. So it's really important to really also focus on those that are most marginalized and most vulnerable to these emergency situations and make sure we get them what they need and prepare them and for the event of an emergency or when it does occur, like making sure we're getting them what they need. So
absolutely.
Yeah, can you talk a little bit? I know you've been doing specifically quite a bit of work in the faith-based organizations. Can you talk a little bit more about that and how that kind of came about? Like, I know for a lot of people in Chicago, faith-based organizations is important to them and really they're center of their community. So yeah, say a little bit more.
Absolutely, yes. So really, we were able to first start connecting with houses of worship. This past year, we worked alongside other city departments, the Office of Emergency Management and Communications, Chicago Police Department, and several others to kind of engage different houses of worship and just kind of provide a basic overview, not only of general preparedness efforts, but specifically about some of the threats and hazards that they might face, whether that's we worked with Office of Emergency Management and Communications, Chicago Police Department, and others to specifically engage houses of worship and help them understand the kind of the resources that are around them, whether that's you know, understanding how to reach 911, you know, via Smart 911, right? There's applications now for everything on your phone. You know, there's a lot of different resources that are available to these different communities. So I think just going out and getting in the community and providing a general level of awareness was really important. And really that's building up towards what the Chicago Department of Public Health is doing, which is engaging different houses of worship to help them develop their own emergency plans, to help them develop kind of what's referred to as an EOP, an emergency operations plan. But really, we're just looking to work with these different faith-based organizations to help them understand what are their unique strengths, right? What do they bring to the table that maybe not others do? Work with them to conduct a risk assessment, understand the threats and hazards that are most likely to impact them, and then as a product of that, understand what resources can they keep on hand to help mitigate or prevent or respond to those different emergencies. And you kind of alluded to it as well, you know, it's important to build relationships when things aren't going wrong, because that way, right, when something does go wrong or when something looks like it might go wrong, you know, you already have that point of contact. You have that relationship, that rapport with them. So that way you're either comfortable asking for help or asking for information. And so a lot of what our engagement with these different community and faith-based groups is focused on is really building that relationship. So that way you're prepared for it when it does happen. Another major output of the faith-based work is those kits we were talking about, right? We want to be able to provide those kits to the organizations that need it most. And as we've already spent time discussing, you know, those community and those faith-based organizations are such a critical part of it. So I think those are big things coming. We're actually hosting a training series to do all of that. It's a 3-workshop training series where we're going to be talking about all those different things. We're going to be linking these folks to different city resources. So there's big things on the horizon, and I think this is just really the first iteration of that course and of that relationship building that I think we're looking to engage the communities to do.
Yeah, no, that's amazing. And yeah, I remember last year I even got to join for one of the food pantries. They were kind of handing out the kits and explaining them to people there. And so that was really important. You already have people that are experiencing food insecurity. We have these great food pantries and organizations that are helping people get access to adequate and healthy food. And so, yeah, it was just amazing to kind of be a part of that. And everybody that got one, we kind of went through it and like, what is all this stuff for? It's just not a bunch of random stuff. So yeah, even that was like a great start, I think, to the initiative, and it's great that we can kind of expand it to other settings and other organizations, and yeah, building that preparedness capacity in these relationships with organizations, so that that's already kind of planted. So in the event that an emergency happens, we know who to talk to, and we already have plans in place. So no, that's great. So yeah, we've kind of been talking about the plans. Can you tell me a little bit more about these kits? Just kind of what do they look like? What's in them? Obviously, I know we've made videos in the past about how people can make their own. Can you kind of take me through the kits?
Absolutely, yeah. So the kits, I think first and foremost, it's important to have a very easily identifiable kit. You know that's your emergency kit. You know where it is, right? It's in a logical place that makes sense to keep it at. If you did have to leave whatever your prime, whether it's your home or whether it's your vehicle, thinking about the places where you spend the most time and making sure you have the right resources at those places. You talked a little bit about, right, there's supplies that make sense to have at any time in any place, whether that's a first aid kit with very basic bandages, ice packs, antibiotic ointment, non-perishable food, water. Those are common things that are valuable anywhere. But like you said, there's also unique circumstances for individuals or for different locations where it might warrant other things. We're in Chicago here, so we certainly have cold winters and we got hot summers. So in the wintertime, making sure that your kit has things like warm weather supplies, a blanket, gloves, a hat. In the summertime, thinking about if you need extra water or even additional ice packs. I think it's important to think about. Like I said earlier, what threats and hazards might exist in these places, and what can I do to prepare for it? So I think those are a couple basic items. Other people, if you have pets, having pet food on hand, having maybe important documentation, whether that's a photocopy of your ID or your passport, whether that's cash, whether that's a deed to a house or a car. I think somebody that was close to me said, you don't get to choose when emergencies, occur, right? It's not often at a Friday at 5 p.m., after you've conquered the day and you're ready for whatever. It could be a Sunday at 1 a.m. when, you get a call that you have to evacuate or do something. So I think just by nature of preparedness, it does require thinking a little bit in advance of things. But like we said, I think there's definitely some common sense things that would be applicable in all emergencies to have ready to go.
Awesome. No, that was a great overview. And in terms of like the emergency planning, are there like some kind of core components you think every individual or family or community should like think about including when they're thinking about emergency planning, like some like components that everybody should consider?
Absolutely. I think we live in a very interconnected world. Communication is very important, and so everybody's attached to their cell phone, but cell phones have batteries, right? They die. So when you're thinking about communications, making sure that you have extra batteries or you have a charger for those things. Again, I think maybe previously people were better at memorizing phone numbers and addresses, whereas maybe, you don't need to do it as much. So, I think it's important to, sure, I might be able to call you when I can access, my phone contacts, but do I have those important names and addresses and phone numbers written down? I think communications is a very big one. I think we've even experienced things where, there's whole cellular network outages and all of a sudden you don't have access to your phone. And I think people see how crippling that can be. So just trying to think of those redundancies. I don't think everybody needs to become an amateur radio operator necessarily, but that is something that a lot of people enjoy, and it's infrastructure that is critically important. When maybe those primary modes of communication do fail. So I think thinking about communications is a big one. And again, I think I've harped on it enough times, but really thinking about the settings that you're in and the hazards that might be present. If you spend most of your time in your car commuting to places, thinking about having common sense items in your car, right? If you think about maybe even keeping your fire extinguishers in your home, is it in a location that makes sense to have it at? If the grill top is going to catch on fire, do I have a fire extinguisher, right in the garage next door to it that I can quickly get to, in the event of a fire? So I think just those common sense preparations for the likely threats and hazards is really important.
Yeah, no, that's important because there's also, different levels of emergencies. Like obviously, like one building or one home can have an emergency, or there's emergencies that impact the entire city of Chicago. And so, there's kind of also those kind of aspects to kind of think about where, if there's flooding going on, it may not impact some people, but if you like maybe live on a lower level or even in a basement, like that will directly impact you. And obviously talking about like fires and things like that as well. So, those are some really good tips, and I really love the hand crank radios now that also have like a flashlight on it, and they also have like chargers for your devices, and it's all just crank it up. I think a lot of us have kind of veered away from radio, but when a lot of other technologies may go out, sometimes that one still can keep us connected and informed about what's going on. So that's maybe a good one to kind of consider, something like that. That's either, there's a lot of solar powered stuff out there now as well. So either like hand crank, solar power, stuff like that.
Absolutely.
All right. Is there anything else that I feel like we talked about a lot in terms of our outreach to the faith-based community organizations, food pantries? We talked about emergency plans, emergency kits. Is there any other aspects you think we should cover and let Chicagoans know when it comes to emergency preparedness?
Absolutely. Yeah, I think we talked about a little bit earlier when we talked about kind of the global interconnectivity that exists and how a problem somewhere can manifest somewhere else so quickly. And I think part of that same conversation is just about the importance of focusing and preparing on not only yourself but also those around you, right? Understanding that we are stronger together, and that although you may not have all the answers or all the resources to solve a problem, there may be others in your area, in your community that also have the resources to solve that problem. And maybe, on your own you couldn't do it, but together you could, because you're able to share those resources and work together. So I would say it's important to think and prepare in isolation, but it's important to understand the environment around you, the people around you, all that context, so that way you really can work together and prepare at a larger level, right? Again, we really are stronger together, and I think that is highlighted time and time again in emergency. Nobody can really do it on their own. It really does take a village.
Yeah, no, I really like that, and just like our interconnected worlds, and especially sometimes like resources are limited, and so it's hard to figure out who needs the most support and who's the most vulnerable. And obviously we really want to focus on Chicago, but it's also important that we're supporting others throughout the country, others throughout the world, because if something happens in another part of the country, in another part of the world, it could easily impact us. So that's why it's going to be really important to continue relationships nationally, internationally, and making sure people have the resources they need to the best of our capabilities. So I really like that. All right. Kind of switching to something a little bit more not as serious. I know we always deal with serious things and preparing for emergencies and responding. But yeah, just to kind of get to know you a little bit more before we wrap up this episode. Want to tell me about one of your favorite local food spots in Chicago? Maybe somewhere that a lot of people don't know about, but you really enjoy.
Favorite food spot? That's a tough one because there are so many, and that's for sure. I feel inclined to at least talk about maybe my favorite place for Chicago hot dog, on the relevance of it. I think if I had to go with my favorite Chicago hot dog, I think I'm going to Jimmy's Red Hots at Grand and Pulaski.
Okay.
I think that's and that's a little more well known, I'll admit. So if you want something off the beaten path, I think there's the Harding Tavern is the name of it. It's just a casual little place to go into for a nice food and drink, and I think that would be my one.
Sounds good. Thank you so much. All right. I'm sure we'll be talking more about public health emergency preparedness in the future. As we talked about, all public health topics have an emergency preparedness aspect. So please keep an eye out on our websites and socials at CDPH for more information, as we often post important information and guidance for the public on potential public health emergencies. So things like extreme cold, extreme heat, air quality advisories, disease outbreaks, and many other important emergency topics. So thank you for joining me today. It's been a pleasure, Joe, and for all your great insight for Chicagoans and all our communities in Chicago on some of the community-based emergency preparedness initiatives and what we can all do to support each other and keep prepared. Thanks.
Thank you.
And that's our show. Thanks for joining us today. Don't forget to rate and subscribe wherever you find podcasts. I'm Dr. Bora, and we'll see you next time.